Good morning. Wonderful to be back in a meeting with all of us in person. And I have to tell you, when I walked in, I see so many friendly faces, the warmth I can feel, the hugs. I mean, it's just so wonderful for all of you to be here. So thank you. And I know a huge number of people are going to be with us on Zoom. And I guess the new norm is hybrid. But I still think that nothing substitutes than being in person together. And we'll be spending some more time together. It's a very important day for us. And I would just thank all of you who are here and on Zoom to join us. Because it is so important, we recognize the urgency for a long-term plan for the nation to stem the crisis of burnout, distress, and loss of healthcare workers. So this plan you're going to hear today, the public meeting, will provide a roadmap for the nation to set forth the priority areas, the steps of actions to be taken, and the actors, all working together collectively to achieve a system where healthcare workforce is thriving in an environment that fosters their well-being and, of course, great for patient care. So let me begin by saying, truly grateful for all of you and by the team that's worked so hard. First, the collaborative and the steering committee, my co-chairs. In fact, Daryl Kirsch is there. Thank you, Daryl. Tom Nasker and Vivek Murthy. Thank you, Surgeon General. But also, I think that the team who's worked so hard deserves a really strong round of applause. And of course, Ann Tran, Catherine Kogan, Sammy Phillips, Kimber Bogart, and Charlie Alexander. Round of applause for them. This has not been an easy task because there's so much to do, and we've worked for the last, shall we say, quite a few months to get to where we are. And I would say that the report, which you'll hear about today, is critically important for us to say, let's work together and let's try to work on this really important problem that we all care about. The bottom line is we care about the patients, healthcare workers, our colleagues, our friends. We want to do everything right to improve their circumstance and their well-being. But I'm really grateful also for the great amount of attention that we're getting from the public and on this issue. And so, in fact, you know, when you think about the plan we put together, I'll tell you how much interest there is in there in the comments that we give. So I do want to say thank you. And, you know, today's session is important because we will be able to move forward to talk about what's needed. And then later on, we'll have a closed session of the smaller group to really map out the important steps going forward. You know, all the sectors have been so interested in this particular plan, invested, that when we put forward the plan, we had 1,700 comments. And there have been so many areas where we got better and better by getting people's suggestions. But I think the reflection that there's so many comments is the fact that people know how important this issue is. So again, thank you very much for being here. So I'm going to now begin by looking at, well, first I want to make the point that this plan is a starting point for many organizations who are committed to make significant changes. And so we want to really take a little more extra time to finalize a few other details. But as you hear today, the priorities, the directions, the actions are very clear, and I think that taking them on will be great. So can I have the first slide, please? I think what I got, I'm going to have to ask you to move it because I think my screen is, okay, great. So these are the 7 priority areas in the national plan. And as I said, public comments with deep consensus, these are the right 3 areas, and the details of what needs to be done. So you can see what they are. First, create and sustain a positive work and learning environment and culture. We recognize that's key in terms of what's necessary to allow our healthcare providers, workers, to have the best environment for their work. Second, to invest to measure, assessment, strategies, and research. So in this case, of course, we want to be able to measure what's going on with our workforce, what's going on, in fact, with their life, and to be able to look at, assess it, to look at strategies to move forward, and importantly, to have the data to get research that can help us guide decision-making and next steps. The third one you'll hear is critically important because we recognize that during this time of COVID and even before, the mental distress, the many stresses, the moral injury that our healthcare workers find themselves can lead to, in fact, mental challenges. And because we need to provide them with the environment to support them. The issue of removing stigma for asking for help, but also enabling the circumstance to support in many different ways for their mental well-being. And of course, addressing compliance, regulatory, and policy barriers for daily work. We all have heard repeatedly these factors, many of them external, need to be addressed so that we can really focus on our patient care, still conforming with many important issues, of course, but let's make it simple, and let's try to make it user-friendly. Technology. We all know that one of the key factors is electronic health record, and I can tell you, I spent the first 3 days at the Aspen Institute, actually with Epic and Cerner CEOs and others, and they are all ready to say they're going to do a lot more work with all of us to address some of the issues. And of course, ultimately, in all we do, as been said by our report, we need to address the systems issue. And addressing system issue, we need to institutionalize the well-being as a long-term value, not just because we're facing a crisis right now, but it has been long-term. And finally, of course, so importantly, is to have a workforce that's diverse, inclusive, and that we recruit and retain them. So those are the 7 factors, and you're going to hear a lot more about this. So let me not spend any more time going through all of them. Next slide. So what you hear is that we have, next slide please, we want to use this moment to say, here we have a plan. Here we have the actors and the actions. How do we actually make sure it works? This is the beginning of a journey. So I took a lesson from Chris Economos through Seth Cairn, who helped us do the retreat over a year ago, about what is a movement. Because the next step is to really take this plan and move it forward as a national campaign, a movement, if you will. And what you see here are the 10 elements of a movement, of a national plan and movement. First of all, you look at frame the crisis. I think we certainly have, as all of you have. Second is, at 6 o'clock, strengthening the science, which many of you present here have done so. And third is to build a coalition. Boy, have we ever built one, and we need to build even more through this initiative. And I really thank all the organizations, also 250 of them, to be involved with this really important initiative. And of course, looking at policy and environment, which we are certainly doing in this report and many other work. And then if you look at further up, make the economic case. Well, I think it's easy to make. I hear from my colleagues whose CEOs, they're really suffering. The cost of care has gone up. They don't have enough workforce. I heard from Toby Cosgrove that Cleveland Clinic at one point had 250 beds not being able to have patients there because they don't have enough workforce. I hear from my colleagues at Duke that the length of stay have gone up from 6.2 to 5.2 days, 5.2 to 6.2. And of course, I hear that financially, the cost has gone up tremendously. So economic case is easily made. And of course, getting government involved. Vivek, thank you, and Carolyn, and they've been really part of this journey. Uniquely, this is truly a public-private partnership. And the Surgeon General's team and the VA have been right there with us in advising, guiding, and of course Vivek's leadership as co-chair. We're working closely with this advisory to, in fact, releasing this national plan. So create a plan, we've done it. So where do we go from there? You can see that there are 3 lines there. Communicate widely. Certainly this is just the beginning of what we need to do, and make sure we disseminate this message. Activate change makers. That's our next step. We're going to have to go from organization to meet with them, to activate them, to have them work with us, and to be the best champions, advocates for change, and of course inspire advocacy. We've thought of a number of different areas. You're going to hear a lot more about our movement, so to speak, going forward. But certainly we've even thought about maybe having a town hall with Dr. Murphy, with Corey Feist and others, to get the public to realize how the big issue is. We're going to try to work on them with CNN or whatever mechanism. So those are the kind of areas that we're going to be strengthening the science, looking at policy, and of course making the advocacy. So this is, in fact, today you're going to hear the detailed plan. Just to put into perspective the Surgeon General's Advisory, which is fantastic, what they have done is so well, and we've coordinated with them so that we call this a 1-2 punch. That is framing the important issue, as Vivek is so good at reaching everybody, and this comes up with some details of what needs to be done. So with that, I would say thank you very much for being here today. I'm so excited for the rest of this morning for us to take it to the next step. And of course, we now move towards, in fact, our keynotes. And first of all, by the way, I need to thank all of you, so a round of applause. Well, we have 2 great keynotes. It's my great pleasure to introduce the first one, which is, of course, Corey Feist, Dr. Corey Feist. And, I tell you, well, first of all, let me tell you who he is. You all know this. He is president and co-founder of the Lorna Breen Heroes Foundation. If there's a time when people step up to say, we've got to do something, the Feist family certainly have done so. Recognize the tragedy, which he may share with you, I'm sure he will. They've gone into action, and that's what we need. We need people who can be advocates, take action, make a difference. And I would say that they have not only inspired all of us, told the story, breaking the culture of silence, but also move on to create this foundation and a movement whereby, as you would know and you'll hear, the Congress move forward with a bill to enable funding and the first step in moving in the right direction. So, Corey, thank you so much for being here. We look forward to hearing from you.
It's great to be with you all today. This isn't intimidating at all. All good. Thank you, Dr. Zhao. Really appreciate it. Thank you for having me today. Thanks to the National Academy and to the Office of the Surgeon General and the Surgeon General as well for being here. Thank you. And thanks to the thousands of healthcare professionals and their families who have supported us, the Dr. Lorna Breen Heroes Foundation, in our work over the last 2 years. This is a foundation that my wife, Jennifer, Lorna's youngest sister, co-founded just 2 years ago. And so Jennifer's here actually in the audience today. We brought our ace in the hole, our daughter Charlotte. Last time we were in town, she got us on Marine One. So we're hoping that Vivek can help us get on Air Force One a little later. No pressure. I'm sure it'll be fine. Charlotte's expecting it, though. You don't want to let down the 14-year-old. I also want to recognize we have 3 members of the board of our foundation who are here today: Pam Cipriano, Tim Brigham, and Steph Simmons, who are here. So thanks for being here as well. I want to tell you a little bit about Lorna, who Victor mentioned, and the namesake of our foundation. She was the director of the emergency department at New York Presbyterian's Allen Hospital. Over the span of 3 weeks, Lorna went from treating confirmed COVID patients to contracting the virus herself, to then trying to return to the front lines. This all happened in a span of 3 weeks in the spring of 2020. She and her colleagues worked around the clock with limited PPE, limited supplies, limited beds. There were patients dying in the waiting rooms. There were patients dying in the hallways. They were having to decide who was going to get ventilators. I spoke recently to a physician who was on the front lines with Lorna, said that alone was enough to break anyone. She contracted COVID and then returned to work on April 1st, 2020. That was her first day back to work. And on that day, she was still depleted. She quickly realized she couldn't keep up. It was too much. She called us and said, "I can't keep up. And I'm concerned that my colleagues and my peers will be able to see that I can't keep up. And this is going to hurt my professional reputation." Nonetheless, she pushed on for 8 more days, 8 days until she broke. She couldn't get out of her chair, and she needed to be hospitalized. Lorna answered the call for her country and her city. And when she needed to make a call for herself, she couldn't do it. She could not prioritize her own well-being above that of her colleagues and her patients because she was worried it was going to end her career, a career she had worked since middle school to achieve. She died by suicide April 26th. After her death, Jennifer and I learned very quickly that the suicide rate among physicians and nurses in this country is twice that of the general population. And this situation existed well before COVID, well before we asked our healthcare professionals to save us from this virus that we didn't know, to take care of our friends and family before their own. Lorna had one significant risk factor, just one, for suicide. She was a doctor. And like Lorna, many physicians and nurses continue to suffer in silence today for fear of the regulatory hurdles and professional repercussions that getting help for themselves will cause. Throughout the past 24 months, our foundation has raised awareness for these issues, reaching over 200 million people. That's almost as many Twitter followers as the Surgeon General has, by the way, with this story. We've been scaling solutions and advocating for policy change. I looked at the slide before, and there were a lot of things on there. I'm like, yeah, check. We've been doing that. Most notably, the Dr. Lorna Breen Healthcare Provider Protection Act, the first ever law at the federal level looking out for the well-being of the workforce. We were in the Oval Office on March 18th, 2022, signing that bill with the President of the United States. This first-of-its-kind legislation was passed because it had bipartisan and bicameral support from across the aisle and across Washington, D.C., and really the country and the world. We had over 70 national associations who were endorsing the legislation, and we could not have done it but for the leadership of U.S. Senator Tim Kaine from Virginia. In addition to that, in the past year, we have launched the All-In Wellbeing First for Healthcare initiative, in which we are scaling solutions that can cascade the industry and remove barriers to mental health access for the healthcare workforce. As part of this work, we've co-created the Wellbeing 5, which are 5 data-driven steps that every health system in this country can and should be implementing right now to support the well-being of the workforce. My favorite on the list is called Get Rid of Stupid Stuff. Understanding that physicians spend 70% of their time, on average, in administrative functions and 50% for nurses, we've got a lot of stupid stuff we can eliminate here, folks. In fact, I would argue that maybe we don't have a healthcare workforce shortage right now. Maybe we just have the healthcare workforce working on the wrong things. In addition to this work, we've developed a toolkit for health systems and licensing boards, insurance companies, and others to use to evaluate invasive questions that appear most often on their applications, such as credentialing applications and licensure applications, the same applications that Lorna feared would be implicated by her getting mental health treatment one time in her career. On January 20th, HRSA allocated the first round of Lorna Breen Act grants, $103 million, or as Jennifer said, 103 million points of light in honor of Lorna, to 46 institutions around the country. And we're hopeful that another round will be funded by Congress in the coming congressional year beginning October 1. In addition to this, we have engaged in a social networking or social marketing campaign that is being overseen by the CDC and NIOSH. In that campaign, we're looking at two audiences, workforce and employers, and understanding the deep science that NIOSH and CDC have on this issue. We are starting first with what I like to call healthcare operations 2.0. How do we redesign this coal mine and not think about having to make those canaries any stronger? Now, while we have developed important partnerships along the way, one of our strongest is with the Schwartz Center for Compassionate Healthcare. They're based in Boston, Massachusetts. They strive to put compassion at the heart of healthcare through programs, education, and advocacy. Like our foundation was founded in name of an individual, the Schwartz Center, too, was founded after their namesake, Ken Schwartz, died in 1995 of lung cancer. Both our organizations have a deep understanding of the issues and the solutions needed to better protect the well-being of the healthcare workforce so they can deliver high-quality, compassionate healthcare. That's why I'm thrilled to share with you today that we are working towards an affiliation with the Schwartz Center to create a coordinated and comprehensive new organization that drives our healthcare system forward in supporting its most valuable asset, the workforce. Through this new organization, we want to inspire hope and solutions for our health system and to ensure that we are meeting the needs of our healthcare community. We'll be hosting a series of webinars, too, which we would love for you to participate in so that we can be in the appropriate place to implement many of the solutions that are advocated in this work plan, as well as that of the Surgeon Generals. We would encourage you all to visit healingourhealthsystem.org to register now for sessions to give us feedback. Now, as we move forward, I would ask each one of you in this room and on Zoom to consider one quote from Mother Teresa. I alone cannot change the world, but I can cast a stone in the waters to create many ripples. If I've learned one thing in the past 2 years, anything at all, it's the impact that one person can make. Lorna and the foundation named in her honor have created one heck of a ripple. We invite and encourage each one of you to join us. Help us turn these ripples into a tidal wave to revitalize and reshape healthcare. Now, with that as the conclusion of my formal remarks, let me introduce the real man of the hour, a guy from Miami just like me. We share outfits usually when he's not wearing his formal outfit, a lot of turquoise and pastels. No, it is my extreme honor, my true honor to now turn the mic over to just another guy from the 305, U.S. Surgeon General Vivek Murthy. Thank you for having me.
Well, thank you so much, Corey, for that really kind introduction. And I might add that to my business card now, another guy from the 305. I like the ring of it. So I'm going to own that. But it is so good to be with everyone today. You know, it was actually a few years ago that I remember being on this stage and with Victor and others. And it was maybe 3 or 4 years ago. And I had forgotten just how warm and wonderful it felt to be in person, you know, until I walked in here. So thank you, Victor and the whole NAM team, for bringing us together in person. And I also just want to thank my fellow co-chairs, Dr. Kirsch, Dr. Naska, and also just some incredible members of the National Academy's team, you know, Ann, Kimber, Charlie, and so many of the others, members of the staff who have helped build this collaborative on clinician well-being for now several years. I know we are here today to celebrate a step forward in building this national action plan, but this didn't happen overnight, and it certainly wouldn't have happened without some of the individuals that I named. Corey, I just especially want to thank you as well for everything that you and your family have been doing in the wake of the tragedy that you sustained and endured during the early days of the pandemic. One of the most inspiring things for me as Surgeon General has been to see people in our country who turn their pain into a passion for helping others and for solving deep, intractable problems. And that's exactly what you and your family have done. So thank you so much for your advocacy and your leadership. You know, the issue that we're here to talk about today, that we're here to celebrate progress on, clinician well-being and health worker burnout, this is an issue that's personal, I know, to so many of us. You know, I think about my own inspiration to go into medicine. It came from my parents. My parents ran a medical practice in Miami when I was growing up. And as a shy kid, you know, who I spent a lot of evenings and weekends in that office with them, greeting patients, filing paperwork, cleaning the office, doing what you do when you're running a family enterprise there. And it was in those moments, even though I didn't understand the science, I came to see what was really beautiful about medicine. You have a chance to care for people during a profoundly important moment in their life. That if you're lucky, you have an opportunity to be a part of reducing pain and suffering. And if you're really lucky, you have a chance to build a relationship. And it was those relationships that I found sustained my parents. And as a small boy, I could see the joy that they got from those relationships. They worked long hours, don't get me wrong. It wasn't easy work they did, but it was joyful work. It was fulfilling work. And it brought them day and day again to that clinic because they found it to be so deeply meaningful. That's what inspired me to go into medicine. But I was really struck when I even entered medical school, how I was seeing so many people like me who came inspired by those ideals who were burning out. I saw more of it when I entered residency. When I finished residency, I saw even more of it in the chart rooms as we worked together to fill in the patient medical record, to do chart biopsies and the rest. I could see my colleagues getting more and more exhausted, losing more and more of their steam, feeling like they had less fuel in the tank. That burnout is common, incredibly common. We know it was common before the pandemic, with around 50% of clinicians saying that they were experiencing burnout. But we know that the pandemic has made this worse for so many as well. During this last year and a half, I've had the privilege of going around and talking to communities across our country, having roundtables with healthcare workers and public health workers, and asking them how they're doing. And the stories are at once inspiring and heartbreaking, because you can see in the stamina, endurance, and commitment of these individuals that they are just dedicated to being there for the people they enter the profession to serve. But you can also hear in their stories and in their expressions and in their tone of their voice what a toll it has taken on them. And that toll is heavy. It's why so many people are actually now considering leaving the profession. It's why 20% of doctors say they plan to leave their clinical practice, why 52% of nurses say they are also planning to leave their clinical practice. One of my deep worries is that the public may not fully understand the implications of burnout for them and for the entire nation. When you get sick, when you break a bone, you assume that there's going to be somebody at a local hospital to set that bone for you. You assume that you're going to have a primary care doctor who's available to give you the care that you need to provide immunizations to your child. But as more people burn out, those basic services that we rely on are increasingly at risk. And so health worker burnout poses a risk to the health security and by extension the economic security of our country. And for that reason, it has to be a national priority. That's one of the reasons why last month I issued a Surgeon General's advisory on health worker well-being and the burnout crisis to call our nation to attention and action to address this crisis. And it's why this collaboration with the national academies has been so important. Because the National Action Plan that NAM is putting together, as Victor referenced to it, this is the 1-2 punch that we need. The Surgeon General's office can call the country to attention and action on critical public health issues, but without the leadership of organizations like the National Academies of Medicine, we have less of a chance of ensuring that it has sustained impact. And that's why this collaboration has been so vital and so important. As Victor laid out, there are a number of areas where the National Action Plan focuses on, areas where we need to create change. People like Corey and others know that there's no one single measure or action that we are going to take that's going to solve this whole crisis. We have to protect our health workers more effectively, protect them against the violence that many of them have experienced, the verbal and physical violence that 80% of health workers say they have experienced during this pandemic. I mean, you think about that for a moment, just to hold there. If you were in any job where 80% of the workers experience violence, that would be a crisis. That in and of itself, putting burnout aside, would be seen as a crisis. But this is what our health workers are dealing with each and every day. And so we've got to do a better job protecting our health workers. And that doesn't mean just protecting against violence. It means protecting their ability to take care of the people in their lives with flexibility in schedules, with support, so that if they have a sick family member, if they're worried about a relative, they don't have to choose between caring for their patients and caring for their loved ones. They need to be able to do both. We also know we have to do more to relieve some of the burdens on our health workers, particularly the administrative burdens. We know that a recent study from a couple of years ago it showed us that for every 2 hours that outpatient, for every 1 hour rather, that outpatient doctors are spending with patients, are spending 2 hours with the EHR and on desk-oriented tasks. Time that patients aren't getting with their clinicians, and clinicians aren't getting with their patients. I sometimes share a story about a patient I was rounding on once in the hospital with my medical residents and medical students. And at the very end of our conversation with her, after we examined her, talked through the plan, the team was exiting the door, and she motioned over to me. She said, "Can you come here for a second?" She said, "I just have a question for you." She's like, "Where do you guys go all day?" She's like, "You come here in the morning, you round on me, and then you disappear. Are you golfing? Like, what are you guys doing?" And I explained to her, it's like, my heart broke in that moment because I knew what my team was doing, that they were, making umpteen calls to get paper medical records from hospitals that didn't share the same medical record system. They were fighting with insurance companies to get clearance for rehabilitation beds and coverage for medicines that we needed to send a patient out on. They were doing so much of the administrative work that is part of our system now, but detracts often from the patient-clinician time that is so vital to creating a fulfilling and healing experience. But in addition to those, we've got to directly support the mental health of clinicians better. In good days, being a health worker is physically and emotionally demanding work. And that's difficult to do without adequate supports. We need to provide that mental health care. And it's not just about having insurance coverage, which, by the way, many lower-wage health workers lack. It's also about making sure that they are providers to care for people, even if they have coverage. And we know too many people have insurance plans with narrow networks or ghost networks that do not have mental health providers for them. But as I heard from nurses around the country, it's also about going one step beyond that. It's about making sure that we bring care to where people are, using the benefits of technology to ensure that if you're working the night shift, that you can still get care. That if you're working 16 hours in a day because things are terribly busy in your hospital, that you can still take a 45-minute break, go to another room in that hospital, use the benefits of telemedicine, and speak to a counselor and somebody who can provide you care. We've got to make it easier to get care. And we also know that the government has an important role to play here. One of the reasons I issued the Surgeon Health Advisory was not only to call the private sector to action, it was also to call government to action as well. And we know that investing and expanding the workforce, doing government's part to reduce administrative burdens, and making sure that we are investing in the public health infrastructure of our country is exceedingly important, and more important, I would say, after the pandemic than ever before. But finally, one last thing that has to change, and this is something you can't legislate, is we have to change the culture within our health professions themselves. Cultures which too often define strength as how many hours you can stay up, how many papers you can cite on morning rounds, how many papers you can publish. But we know, and I sensed as a 7-year-old boy in my parents' medical clinic years ago, that strength was about something bigger than that. It was about something even more human than that. It was about the empathy you're able to provide at the bedside. It was about being able to listen to somebody who may be suffering and stay in the room. It's about showing up when someone's in need. That is the most powerful resource that we bring as health workers. And we have to create a culture where it's okay to ask for help when we feel that our emotional tank is low, where it's not seen as a sign of weakness to ask for that help or to take time to get counseling and care or other care. And that's something that each of us has to look at within our own systems and see what can we do, what can we say, who can we support that will ultimately help change that culture within the health professions. In closing, I just want to say I know that this is personal for all of us, as I said at the very beginning. We came to this work in order to help and support patients. We came to this work to help reduce suffering and to help heal. And it shouldn't be this difficult to do that. It's not too much to ask to have a system that actually supports health workers in the work that they are trying to do. I'll share with you in closing that I remember that I've gotten many messages over the last year or so from health workers around the country talking about their struggles. But there's one that stands out to me, which is a message I received from a nurse in New York who entered the nursing profession decades ago. And she told me just how deeply fulfilling it has been for her. She said that during the HIV crisis in New York, she went to work at a community clinic to provide care for people even before we had a clear sense of what HIV was. During the height of one of the heights of the homelessness crisis, she went to work at a homeless shelter to provide care for people who are otherwise shut out of the healthcare system. After 9/11, after Hurricane Katrina, after the wildfires, she helped and cared for people who were hard hit, and she wrote condolence cards to those she couldn't reach directly. But when the pandemic hit, she did what she'd always done, ran to the front lines to help. But she said she never sustained the kind of attacks and vitriol that she sustained during COVID. The attacks from people who had absorbed misinformation about vaccines or treatments or COVID itself, and who thought she was part of a broader conspiracy to get everyone to wear masks, or to think COVID was something bigger than the flu, which it turns out it is. But these attacks wore her down. They sucked her energy, and they just diminished the fuel that she had in her emotional tank. And finally, she made the decision to leave nursing 10 years earlier than she otherwise would have. Her story is a story of great loss. We took somebody who was so committed to helping, who had dedicated her life to healing, and she was driven out of the profession. And hers, unfortunately, is not the only story. There are so many like hers. And that is why this movement that we are building in the country is so important. This movement to address burnout, but to create a foundation for well-being for clinicians all across our country, for public health workers across our country. And this is a movement that cannot be sustained by health workers alone. We need to bring the broader public into it. We have to help the country understand that health worker well-being is a national priority. This is not a niche issue. This is a national issue. And we fundamentally have just an obligation to do something, not only because burnout affects the health security of the nation, but because it's the right thing to do. Because as a nation, we should have the backs of those who have had our backs for years. We should care for those who have cared for us through crisis after crisis. So all that to say, I'm grateful for today. I'm grateful for the National Academies, to Victor for his leadership in making this National Action Plan possible. I'm grateful to all of you for being the leaders and foot soldiers of this movement that we will build and sustain together. And by doing so, we will do right by those people who have entered the profession with high ideals, who have the power and the potential to help so many more, and who just need a little bit of support, a little bit of help to do so. We can make sure that support and help is there. So thank you so much.
I'm Darrell Kirch. I have the honor of being President Emeritus of the Association of American Medical Colleges, and I want to briefly, I'm serving as one of the co-chairs of the initiative, and I want to briefly talk about who are the actors, who are all of us who can have an impact here. So with my colleagues, I want to lead off by saying it isn't just the electronic health record. It isn't just our CEO. It's all of us. We are all, to use a phrase, unindicted co-conspirators in this problem. So we have identified 10 groups. It's not totally exhaustive, but I think these 10 groups are key players in the state of the well-being of our clinical workforce. First of all, it's an issue of how we train people. So the academic institutions, clinical training programs, the bodies that accredit those programs are absolutely critical. It's how you're trained that influences how you practice. The second group would be the federal government, and some of my colleagues are here from the VA and other bodies, but the federal government is an important actor in all of this. It's not just the Department of Health and Human Services and all of its bodies like the CDC and others. Think of the Department of Education, the VA, as you'll hear. So all of those federal agencies that set regulations, that administer legislation are critical. Then we have the health IT companies. Yes, the electronic health record is an issue. It was designed for billing, not for clinical care. But we have a number of other IT issues that impede, that create that impede clinicians from being at the bedside or in the clinic and create obstacles to their daily work. I was at a meeting this weekend with about 15 health system CEOs, and they were very eager to talk about their falling margins as they're experiencing in the months of 2022. And at the same time, I felt in that discussion their falling workforce. The people who are leaving the workforce or who are working at less than full speed in the workforce were an equal problem. Those workers aren't just physicians and nurses. They're the pharmacists, the occupational therapists, the respiratory therapists, on down through all the people who touch patients, including family caregivers. In many cases, it's the family that is bearing the brunt of patient care and experiencing burnout in the process. We have the insurers who have their agenda, which isn't always aligned with the care of patients. And the insurers tend to follow the path of, going back to one of the earlier actors, the Centers for Medicare and Medicaid Services, CMS. They set the tone, the insurers follow, and the caregivers have to work within an environment that often is more focused on reimbursement than on patient care. Media, communications, we have left thoroughly the world of traditional media. Social media and all that it has brought is a critically important actor in this, because we have also entered a world of not just information, but disinformation, which influences all of our colleagues in this process. Patients should be at the center. Often they're not. Patients and their families should be driving this process. Often, despite our best efforts, they're marginalized in their care. We have the private and the nonprofit funders. This has been one of the most rewarding experiences of my professional life, to see how many agents, including foundations and others, care about this problem as much as all of us on the call and in the room do. And finally, there are the professional and specialty societies. I'm at a stage in life where I can speak the truth. Too often, our specialty societies, our professional societies operate as guilds, protecting the interest of the practitioners as opposed to the interest of patients and families. This is an all-hands-on-deck situation. I am really pleased that the National Academy of Medicine has taken a leadership role in all of this, and I think we are making progress. Finally, after years of denial, we are taking this problem on. I want to introduce Dr. Carolyn Clancy, who is the Assistant Undersecretary for Discovery, Education, and Affiliate Networks, DEAN, which makes her the Dean of the VA. Dr. Clancy.
Thank you so much, Darrell, and good morning, everyone. I want to express my thanks to you, Darrell, to Dr. Zhao, Dr. Murthy, and Dr. Naska for your incredible leadership of the Action Collaborative on Clinician Wellbeing and Burnout. For the next few minutes, I just want to share VA's perspective as well as a federal government actor on health worker well-being, and then note a few key steps to consider as we move forward with this national plan, this national movement, as Dr. Zhao said. The first point I'd like to make is we have been tracking burnout since 2013. We have a pretty in-depth all-employee survey that gets fielded every year, and I'll just say we do everything that it takes, and many of you know what that is, to get a good response rate so we get reliable results. Our most recent survey from fiscal year 2021 showed that 5% of our VA colleagues had very severe or high burnout, but that nearly half of the employees, these are employees who work in the health system, had reported experiencing at least one symptom related to burnout. 5% may sound low, but if you think about that other half as being potentially moving on to that level, it's pretty scary. We've also learned that the persistent gap between physicians and nurses on burnout has widened, and this is an important reminder, if we needed it, that burnout is hardly limited to physicians, and it reaffirms, I believe, the incredible role nurses have played throughout the pandemic and cautions us about the future. Prior to the pandemic, according to a 2019 NAM report, 35 to 54% of nurses in this country said they'd experienced burnout. And today, given estimated retirement numbers, the nation will be short about 1 million nurses by the end of 2022. Many of you are living with this every single day. Can you imagine if we had been short 1 million nurses in March of 2020? I mean, it's beyond our capability. So at VA, Secretary McDonough has made the well-being of VA employees a top priority. In February, he announced a 10-point human infrastructure plan to make every VA job a good job, so that every VA employee is empowered to provide veterans with world-class health care. Many aspects of that plan, as well as several of our own initiatives and programs, directly align with the NAM action plan. For example, Step 7 of the Secretary's plan focuses directly on supporting employee wellness and reducing burnout, and led to a new employee-led task force. So my awesome colleague, Dr. Mark Upton, is here, and he's one of the leaders of something called Reboot, Reducing Employee Burnout and Optimizing Organizational Thriving. Now, Mark's commitment to servant leadership and, frankly, his ability to inspire means that across our system, I can't even tell you how many employees believe that they are leaders in this movement for our system, and they are. So they've been looking at things like how do we improve work conditions, how do we promote work-life balance, how do we increase flexibility, among other key considerations. And we've seen an enormously positive response to that. We've also been focusing on tools that we can deploy right now and helping employees and veterans. So we have an employee website with many resources, including apps and videos, to help both employees and veterans take care of themselves. One of them is a collection of videos with the hashtag #LiveWholeHealth, which focuses on how-tos for yoga, mindfulness, Tai Chi, acupressure for low back pain, and so forth. Another section, and this is actually one of my personal favorites, is called Value and Appreciations. It includes a specialized email message, and it's really quite a lovely feeling to get one of these VA gratitude messages. And the hashtag is VA Gratitude for employees and supervisors to send to one another. So in addition to that, all of us have seen how dramatically and incredibly the healthcare system writ large responded to this pandemic, like a light switch, right? We went from our usual business to figuring out how do we protect patients, how do we protect employees, lockdown, right? And for a variety of reasons did a very good job. And the question is what comes next whenever we get to what we've called endemic phase and so forth. So some of our innovation colleagues are leading an initiative called Reimagining Veteran Health. And they are using a human-centered design approach with employees and veterans to try to envision how do we transform post-pandemic. But one of the 6 key insights developed by our staff, number 3, says it all. Take care of us as we take care of veterans. And that is a message that I think we need to foot stomp and articulate clearly to the public in particular, emphasizing Dr. Murthy's point. So as we look forward to the National Plan's release, I'd like to make 2 other considerations known. First, as we seek to strengthen our healthcare workforce, I believe we have to really expand our definition of that term. For the Veterans Health Administration, this is everybody. It brings new meaning to a team sport, and if we ever forgot that, the past 2.5 years have really reminded that. Second, and to really emphasize a point that Victor and Darrell made earlier, we can never underestimate the power of partnership when it comes to achieving high-priority goals. So we are beyond appreciative of the 200-plus organizations that have participated in the development of the National Plan, and I do just want to make a special shout-out to Ann, Catherine, Charlie, and Kimber. Wow, I really actually don't have words for trying to keep all of these people in motion and excitement, all orchestrated and converging towards one goal. Please know that VA stands ready to work with you and help spark and build that national movement for health workforce well-being. So thank you for inviting me to join you today. And now, it is my great honor to introduce Dr. Rachel Villanueva. She is the 122nd President of the National Medical Association and a clinical assistant professor of obstetrics and gynecology at the NYU Grossman School of Medicine. Dr. Villanueva.
Good morning, or maybe afternoon. No, it's still morning yet. Thank you, Carolyn, and thank you for the opportunity to speak on behalf of the National Medical Association. I want to first thank the co-chairs of our collaborative for leading this, the National Academies, and the Office of the Surgeon General. I've come on late to this project, about a year in, I think, but it's really been an incredible experience and really something that for the National Medical Association is an important part of our association now. We were born in 1895. Oh, I also just want to recognize one of our other past president, Dr. Edith Mitchell, who has long been a member here and active participant. And the NMA was born in 1895 out of the needs of African American physicians and patients that were subjected to discriminatory practices that still impact our healthcare system today. We not only represent the interests of those Black patients and physicians, but also all of the underserved and under-resourced individuals in our society. And while the issues of worker well-being and burnout predated, obviously has been said many times, predated the pandemic really has forced an urgency of the situation. And specifically, the pandemic disproportionately impacted workers of color, both professionally and personally, as their communities were disproportionately impacted by death in numbers. And while all of the priority areas of the national plan, which is truly incredible a plan, are crucial to the overall well-being, I'm just going to highlight a few that I think are impactful, specifically as far as aligning with the mission and the organizational goals of the National Medical Association. Recruitment and retention of a diverse and inclusive health workforce, creating and sustaining a positive work and learning environment and culture, and support of mental health and reducing stigma. And as we unfortunately know, only 5% of physicians are African Americans, while we comprise nearly 14% of the population. Our physicians disproportionately work in communities that are underserved and resourced. And our providers of color provide care in those care deserts, in those rural areas, in those places that don't necessarily always have great access to care. We know that improving health outcomes comes with improving that workforce. Research has always supported improving diversity of medicine, healthcare delivery, and our educational systems, and improving cultural competency, addressing shortages, and increasing research and expanding not only leadership but mentorship as well. So we understand that physician burnout and shortages will continue to disproportionately impact rural communities and communities of color, exacerbating the already existing disparities. And we recognize also that the health ecosystem is not just physicians and nurses. It really comprises a whole host of healthcare workers that keep the system alive and working. And many of those come from marginalized communities. So the intentionality of this national plan in cultivating a diverse, equitable and inclusive work plan for the whole of the workforce, and not just physicians and nurses, speaks to the heart of the NMA. It's not only at the level of the healthcare system, but investing in educational programs, pathway programs to healthcare opportunities and careers, community partnerships, and recognizing that social determinants of health don't only impact our patients, but actually impact those healthcare workers as well and their ability to reach their optimal potential. The plan takes a global understanding of the needs of the workforce and importantly incorporates those unrecognized and often forgotten workers of color that support the system. And as structural racism and bias still permeate our healthcare system, affecting healthcare outcomes and exacerbating inequities, our healthcare workers similarly suffer negatively in their education, training, and workplace environments. Because unfortunately, racism is embedded in our healthcare and educational systems, and we can no longer deny that those that work within it are not subjected to the ill effects of it. Medical students recognize race as a significant contributor to stress during their education. Minority physicians experience workplace harassment by both patients and superiors. There's implicit bias, overt racism, stereotyping, and microaggressions, all things that lead to feelings of self-doubt and isolation for those individuals, affecting career and work satisfaction, exacerbating stress, and leading to increased burnout and compromising mental health. But the national plan, importantly and adeptly, tackles these very sensitive issues and experiences faced by ethnically and racially diverse individuals by prioritizing a positive work environment and culture. Emphasis is not only placed on recruitment of diverse environment, but the retention of it as well, turnover, mentorship, creating mechanisms to address discriminatory behaviors, cultural training, and ultimately not only creating a culture that is diverse but inclusive, most importantly. Specifically, supporting mental health and reducing stigma is crucial to healthcare well-being, but plays a significant role in communities of color where stigma is deep-seated in culture. Seeking mental health support in the Black community is often seen as a sign of weakness. We've overcome slavery, we can overcome whatever is happening to you right now. And while people of color experience healthcare struggles, mental health care struggles, in similar proportion to the general population, we don't seek treatment or obtain treatment in similar numbers. And about only a third of us actually seek the treatment that we need. Some barriers include, in addition to stigma, include lack of diversity of providers, lack of access, insurance issues, and racism. As a plan priority, the importance of normalizing mental health struggles, normalizing the seeking of assistance and care is especially important in communities of color and will be integral to obtaining optimal health for all. And as a framework, the plan is a living and breathing document. Importantly, it does not place the onus on the of worker well-being in one particular organization, leader, or actor. It requires the whole system. Every priority area requires a comprehensive plan, including all actors. We recognize that these issues that we're dealing with are deeply entrenched in our society and healthcare system, and change will not be immediate. The NMA is proud to be a member of the steering committee and grateful for the opportunity to participate in these critical conversations. At our upcoming national convention, we will highlight the national plan during one of our signature plenaries, which was entitled Surviving as a Black Physician, Well-Being, Resilience, and Viability. And it'll also address systemic racial attacks by licensing boards that have recently been faced by more physicians, increasingly faced by physicians. Organizationally, we are committed to a more intentional incorporation of wellness, of addressing wellness and burnout in our upcoming strategic agenda. Moreover, the NMA will remain committed to the success of this ongoing work that addresses experiences and develops strategies to improve the well-being of our healthcare system and our workforce, but with cultural respect and humility to identify those unique experiences of marginalized populations within that healthcare system. That's when we'll have a truly comprehensive national plan that will promote a positive, inclusive work and learning environment, and that will produce a cultural shift and the action needed in our healthcare system, not only to benefit the patients that we serve, but improve the well-being and longevity of the individuals that work within it. Thank you so much.
Good day, everyone, and thank you to both Dr. Clancy and Dr. Villanueva for your remarks and all your efforts in clinician well-being and service to all. My name is Tom Naska, and I am the president of the Accreditation Council for Graduate Medical Education and co-chair of the Action Collaborative. I'd like to add my thanks to all in the audience in Washington, D.C. today and across the country for your participation today, and into the future of this pan-professional effort to improve the well-being of those who serve the health and healthcare needs of the public and whom we have sworn to serve. Our job in this session is to light the spark that triggers the national movement for health workforce well-being. Let me open this session with a brief description how I and my organization, the ACGME, became involved in these efforts. It began, unfortunately, with the death by suicide of a surgical fellow in Chicago in 2010. We were individually touched by the commitment of his family to do something to prevent such tragedies in the future, a goal that we shared. The emerging literature on burnout and depression among medical students and residents mounted during that period of time, and we began a national educational effort to alert the field to these trends. In August 2014, 2 first-year residents died by suicide in the same institution within a week, and we became alarmed. The ACGME initiated a national-level discussion among groups responsible for medical education and committed to fund 4 annual meetings to address the issue. At about that time, my colleagues and I completed a 15-year study of the cause of death of residents in ACGME-accredited training programs. We found that although residents die at a significantly lower rate than their age and sex-matched peers, death by suicide was the most frequent cause of death of male residents and the second most frequent cause of death of female residents. After the second of the annual educational conferences sponsored by the ACGME, Darrell Kirch and I had a conversation from which emerged the recognition that this was not a problem that could be addressed solely by the educators. From this recognition emerged the request that we presented to Victor to form the group that eventually became both the Action Collaborative as well as the consensus study and report on clinician well-being and resiliency. From those 2 efforts now emerged this National Plan for Action. So it is time for all of us not only to understand what needs to be done, but also to commit to doing our part to make the desired future state a reality. If we are to translate a national plan into a successful movement to achieve the goals of the plan, each of us must commit to an action. And if Victor, Darrell, and Vivek and I are going to ask you to commit to this action, it's only proper that we go first. As you will see in the national plan, accreditors are called to certain tasks. Among those, the creation and maintenance of a positive working and learning environment is paramount. In addition to collaborations with you across all professions, on behalf of the ACGME, we make the following commitments in specific domains of activity. The ACGME has committed to and will remain committed to the creation and sustaining of a positive working and learning environment and culture. Let me be specific about some of those existing efforts and future commitments. Clinical Learning Environment Review Program and CLEAR is an ACGME formative evaluation effort in support of sponsoring institutions' clinical learning environments, including its well-being efforts and its culture. The individual institutional results are only shared with that institution, and the national aggregate data is published periodically in the National CLEAR reports available on the ACGME website. The ACGME commits to continue to provide and evolve to meet the needs of the educational community in this domain. ACGME sponsored the development of the National Collaborative to improve the clinical learning environment. This is an interprofessional effort and focuses on interprofessional education, safety, and well-being. ACGME will continue to support that effort. ACGME has developed and will continue to sustain a broad array of synchronous as well as asynchronous educational programs and tools for programs and institutional efforts in support of learner and faculty well-being. The ACGME has developed and will sustain and provide to the community tools for programs and institutions to guide their actions after unexpected losses of colleagues. ACGME will continue to annually survey more than 146,000 residents and fellows and more than 90,000 faculty and provide feedback to programs and institutions designed to improve the clinical learning environment. The ACGME has implemented standards that require 24/7, 365 availability of mental health support services to be available to all residents and fellows. ACGME has implemented standards that require programs to evaluate their culture of well-being and educational programs, both synchronous and asynchronous, in diversity, equity, and inclusion, and has implemented standards related to identification and elimination of discrimination, harassment, bullying, and other unprofessional behaviors. The ACGME has implemented personal leave standards that support personal, parental, or caregiver leave for residents and fellows in ACGME-accredited programs. And the ACGME has implemented standards regarding safety from violence and other threats for all ACGME-accredited programs. The ACGME commits to persistent action to produce and sustain positive working and learning environments for all involved in these environments, not just those for whom we have primary responsibility. We all share the lifelong learning, clinical learning, and working environment. It must be safe and effective for all, not just physicians and physician learners. We support the pan-professional interdisciplinary efforts of the Action Collaborative and will continue to work with colleagues from across the healing professions to bring about the cultural change called for in this national plan. It's now my honor and distinct privilege to introduce to you Dr. Ernest Grant, President of the American Nurses Association and a colleague of mine on the steering committee of the National Academy of Medicine's Action Collaborative. Dr. Grant is the 36th President of the American Nursing Association, the nation's largest nurses association, representing the interests of the nation's 4 million very important people that are registered nurses. Dr. Grant has more than 30 years of experience in nursing and is an internationally recognized burn care and fire safety expert. He previously served as the burn outreach coordinator for the North Carolina J.C. Burn Center at UNC Chapel Hill. Dr. Grant, we look forward to your comments.
Thank you very much. Thank you, and let me say it is indeed an honor to be here, and Dr. Zhao and your staff at the Academy, we thank you for the opportunity to be here today. The American Nurses Association is proud to have had the opportunity to have collaborated with and contribute to the NAM's Clinician Wellbeing Report. We recognize that the well-being of the nation depends upon the health and safety of all healthcare workers and providers. We also recognize that it takes collaborative action and working together to maintain a focus on clinicians' health. This report is the result of the consensus process that explored areas of needs following the unprecedented pandemic that further stressed an already strained healthcare workforce. The 7 priority areas addressed in this report fits in with many initiatives already undertaken by the ANA, our 50 state constituent and state nurses association, the individual membership division, and our 39 organizational affiliates. For example, the second priority, invest in measurement, assessment, strategies, and research, is a prime example of how ANA used national research to help decrease health worker burnout and improve their well-being. At the beginning of this pandemic, the American Nurses Foundation launched a national survey that became known as the Pulse of the Nation's Nurses Survey. This survey has continued over the past 2 years and has yielded some very valuable information. In the very first survey, and continuing to our most recent one, we noted the severe mental and physical fatigue that nurses and other members of the healthcare team were facing in reporting. Other factors, including financial strain that nurses and other healthcare workers were facing due to furloughs, and for those that were at the bedside, an identified need that further education on the care of the COVID-19 patients and donning and doffing PPEs and other resources that they needed was in need. In a quick turnaround action, ANA created a COVID-19 resource website in which educational programs, frequently asked questions, and other valuable information was made available to nurses and the public. Additionally, nurses were encouraged to access, join, and participate in offerings of the Healthy Nurse, Healthy Nation program, whose goal it is to connect and engage nurses, employers, and organizations around improving health in 6 major areas: mental health, physical activity, nutrition, rest, quality of life, and safety. Nurses are encouraged to take an initial health assessment survey and obtain a heat map of their health risk. Next, they pick their focus area or areas and make a health commitment to participate in health challenges. They may also connect with others for support, advice, and share their successes. Healthy Nurse, Healthy Nation has been measuring nurses' wellness for the past 5 years and has a wealth of data that reflects nurse burnout and that nurses' well-being indeed is a priority. The third priority, support medical health and reduce stigma, is also an area in which ANA and our State Nurses Association has been diligently working. Through funding supported by our foundation and reflective of the mental health needs identified by the Healthy Nurse, Healthy Nation campaign, ANA teamed up with the Association of Critical Care Nurses, the Emergency Nurses Association, the Association of Perioperative Nurses, and the American Psychiatric Nurses Association to establish the Well-Being Initiative. This initiative gives nurses access to digital mental health and wellness-related resources, tools, and more to support their emotional well-being and while taking care of those affected by the virus. This comprehensive offering includes both responsive measures such as peer-to-peer conversations, warm lines, hotlines, cognitive processing techniques, etc., and preventive actions to reduce stress, mindfulness, and educational materials. It was also discovered that nurses and other healthcare providers were reluctant to seek mental health counseling because of their perceived stigma associated with such actions, in the fear that it would have impact their health insurance or professional licensure. ANA and other nursing organizations have had initial conversations with insurers and with some regulatory agencies to identify strategies that will reduce the stigma associated with using mental health resources. Finally, the seventh priority, recruit and retain a diverse and inclusive health workforce. This has been a personal goal of my presidency. I have long said that the nursing profession, as well as other areas of healthcare for that matter, should resemble the population that we serve. It is critical that we bundle our resources to encourage, recruit, and advocate for a more diverse and equitable healthcare team or system that is reflective of our society. It is important that we role model and mentor minority boys and girls and provide them with the resources that they need in order to be successful. It means higher quality of care for patients. I also believe that a more diverse nursing and healthcare workforce will be more effective in helping our society address the growing racial disparities in healthcare and health outcomes. And finally, we know that it is impossible for one organization to undertake the priorities outlined in this report on their own. We must realize that it will take all of us working together to support a healthy healthcare workforce. Our patients and our healthcare consumers will benefit, and we as members of the healthcare team will certainly benefit as well. It is now my pleasure to introduce to you Mr. Jeffrey T. Woods, a second-year medical student at the Mayo Clinic Alex School of Medicine. Jeffrey.
Thank you so much, Dr. Grant. I really appreciate having this chance to speak with all of you. It's just a privilege to be here, and I'm really grateful for the efforts that are going into developing this national plan. As a medical student, I'm grateful to be able to add a final voice to today's meeting from the next generation of healthcare professionals. So I was asked to share a little bit about my own journey with well-being as a background to my overall remarks. So like Mr. Feist did at the beginning of today's session, I'll share a personal story. I hope it provides a perspective that proves to be of some value to you. So by way of my background, I studied philosophy and religious studies at Stanford for undergrad and Harvard Divinity School for graduate school. And then after graduate school, I practiced and taught meditation and yoga full-time for 10 years before starting medical school a couple of years ago. So in my unconventional path to medical school, out of all of those experiences, my time practicing and teaching meditation and yoga was the most formative for my perspectives on well-being. Up to that point in my life, through school, undergrad, and grad school, I primarily developed my ability to think, to acquire knowledge, and to achieve, not my ability to know who I truly was, to promote my own well-being, or to support others' healing and well-being. So as a result, when I first started teaching meditation and yoga, I felt completely out of my depth and ineffective. But gradually, as time went on, I realized I wasn't lacking in the ability to teach. It was simply that my own habits, especially my constant thinking, my self-judgment and perfectionism, were coloring my perceptions and shaping my interactions with others in ways that prevented me from making the positive and healing impact I hoped. Over time, I learned to be attentive and present, finding that when fully present, my habits would fall away and what truly motivated me, an innate wish to bring goodness to others, would spontaneously arise. Attentiveness and presence brought me greater personal well-being, but it also enabled me to interact with others in a way that was truly healing. So I'm sharing this part of my personal journey not to extol the virtues of mindfulness to you, but rather to say that I was trained and incentivized, and I think the vast majority of medical students have been trained and incentivized to approach our studies, and really most or all of our life, in ways potentially at great odds with personal well-being and with promoting others' healing. As I said before, medical school, I focused almost exclusively on thinking and acquiring knowledge. I focused on performing and achieving, on excelling in comparison to others. I wasn't connected to what truly motivates me or to what brings me well-being. And as a result, the quality and depth of my interactions with students, and after that with patients, was limited. It was limited by the quality and depth of my connection to my own self. Since starting medical school, even though I spent all that time practicing and teaching wellness, I've found that old habits die hard. I found myself once again drawn to focusing on performance, comparison, and achievement. And I look around me and I see so many fellow medical students across the country likewise focused almost single-mindedly on achievement, competition, and performance, burned out and alienated from the motivations that drew us to medicine in the first place. Some of that is just inherent to medicine. There's a need to focus on performance and excellence when patients' lives are going to be in our hands, and there are, objective standards for performance that we must attain. However, much of it can also be mitigated. For instance, ways that medical culture and hierarchies can injure the self, and ways competition detracts from ideal growth and care. I enthusiastically support the National Plan's initiative that address some of these factors that can be mitigated. The priority of the plan places on creating and sustaining positive work and learning environments and culture, on institutionalizing well-being and medical culture, on recruiting and retaining not just a collection of the highest performers, but a truly diverse and inclusive health workforce that can meet the needs of our diverse patient populations. At the medical school level, these areas of focus can translate to greater diversity and inclusivity in admissions, to a reimagination of undergraduate medical culture, to the creation of more holistic evaluation methods that incentivize med students to connect to healing and to what truly motivates us instead of competition with other learners. In closing, events like this really re-inspire me that there's a better future for medicine that we're all working together to realize. And if it can be any inspiration to those of you, which is pretty much all of you who have been in the medical field longer than me, know that you have partners, like myself, in this work among the next generation of physicians and healthcare leaders. Thank you so much again for this opportunity to speak with you all.
Thank you, Mr. Wood and Dr. Britton, for those very important words. All of us have heard our aspirations for a better future, a culture that values each person on the team, giving them the full opportunity to share their gifts as healers with those we serve, and foster their personal and professional growth. This is the kickoff of our campaign to solicit, renew, and reinvigorate commitment statements from all of our network organizations and invite new network stakeholders to commit prior to our regional dissemination meetings begin this fall. Now it's my pleasure to turn the microphone back over to our leader, Dr. Victor Zhao. Victor?
Thank you, Tom, and thank you, all of you. and particularly presenters and staff who's just done a fabulous job teeing up what we need to do going into the future. It's clear, as has been said, this is the beginning of a journey. I would say that it's exciting and encouraging that finally so many people are getting together to put forward a national action plan. And our job is to make sure that we don't leave it on the shelf, that in fact it gets acted upon, and that's what we're going to be doing the next months to years. And I thank everyone who's committed to working with us in this area, and so many others who's supporting this. So thank you again. As I close this meeting, I would say that the Action Collaborative members are going to meet. You're going to meet in room 120 as you go out, turn right, and we can jump right into talking about how we're going to move this forward. So thank you so much. I'm truly moved and truly encouraged by the warmth and the encouragement and the support that we get from all of you. So thank you.